Laura, I'm 23 and I've just begun to do the steps for BPD, which is like I think it's a CBT therapy course for people with borderline personality disorder or emotional intensity disorder. Okay, STEPPS stands for Systems Training for Emotional Predictability and Problem Solving. It's a group treatment program for borderline personality disorder. Okay, I'm halfway through the course already. So I'm just going to explain today what borderline personality disorder and the STEPPS course and stuff before I go to my next session. Or STEPPS. Okay, basically what borderline personality disorder is a pervasive pattern of instability of interpersonal relationships, self-image and affects, and marked impulsivity beginning by early adulthood and present in a variety of contexts as indicated by 5 or more of the following from the list of symptoms. Frantic efforts to avoid real or imagined abandonment. Note: do not include suicidal or self-mutilating behaviour covered in criterion 5. A pattern of unstable and intense interpersonal relationships characterised by alternating between extremes of idealization and evaluation. 3. Identity disturbance. Persistent and markedly disturbed, distorted or unstable self-image or sense of self. 4. Impulsivity in at least 2 areas that are potentially self-damaging, such as spending, sex, substance misuse, reckless driving and binge eating. 5. Recurrent suicidal behaviour, gestures or threats of self-mutilating behaviour. 6. Affective instability due to marked reactivity of mood, intense episodic dysphoria, irritability or anxiety, usually lasting a few hours and only rarely more than a few days. I'll explain that later. 7. Chronic feelings of emptiness. 8. Inappropriate, intense anger or lack of control of anger, frequent displays of temper, constant anger, recurrent physical fights. And 9. Transient stress-related paranoia, idealization or severe dissociative symptoms. Okay, you've got to have 5 or more to actually be in the BPD criterion or whatever you call it. Okay, basically STEPPS is a 20-week group therapy session where we learn communicating, challenging, distraction, managing problems, behavioural management, setting goals, eating and sleeping, exercise, leisure, physical health, abuse avoidance, relationship behaviours, and a few more things. Skills for STEPPS, like awareness of the illness and describing and understanding what BPD EID is. Filters. A filter is an extremely stable and enduring pattern of thinking that develops during childhood and is elaborate throughout an individual's life. Okay, filters are like when like it's like wearing googly glasses. It's like wearing googly glasses, where you can't actually see properly through them. Like when, I'm sure my friend Adele gets this quite a lot. When I abandon her, she also has BPD by the way. When I abandon her, she feels like this. She feels like I'm abandoning her and stuff, and her filters play up and she does crazy things. Okay, and basically we have a list of filters that actually tell us that I'm not abandoning her and stuff. I'll explain more later as well because my time's about to run out. Challenging, identifying distorted thinking and develop alternative ways of thinking. Distracting, behaviours that lower emotional intensity to help you get through an episode without damaging behaviours. Managing problems, identifying and define problems, plan and carry out action steps, setting goals, develop strategies to manage specific problematic behaviours, eating balanced eating habits, sleeping good sleep habits, exercise, regular and balanced exercise, regular leisure activities, working effectively with healthcare professionals, abuse avoidance strategies to replace abusive behaviours, relationship behaviours, developing healthy relationships and defining healthy boundaries. Okay, you might want to hear that bit. Okay, we have a skills monitoring card, which I will explain at, I think, lesson 1, which I will say later, because I don't want to bore you too much. But also, emotional intensity continuums, or basically weather forms, pot forms, and volcano forms. Okay, this is basically a graph of what it's like having BPD. Okay, people's emotions with BPD, if something happens like a boyfriend or girlfriend didn't ring, people with BPD might get like, he didn't ring, oh my god, something's happened, he is with someone else, and all these filters are going around in your head, and basically someone's with BPD, emotions go whoosh and it takes ages to go back to normal. It could take up to about quite a few hours, but rarely days. But someone without BPD, they may get like this for a couple of hours and then they go back down to normal level, and yeah. Okay, hopefully I explained that well. Okay. We also have a reinforcement team, which can be like your care coordinator, a psychiatrist, a friend, relatives, a therapist, care coordinator, social worker, or whatever you want. They will actually help you manage there's actually like help with like your BPD skills, your STEPPS skills and stuff. Okay, and that's finished for the introduction. Okay, thank you for listening, and I'm sorry if I bored you.